So, Fred, you've been telling me that you have a hard time getting up and down from the ground or even moving equipment around to do your exercises. A lot of my patients have that same issue. I'd like to show you a few things that you might find interesting. In family medicine, we are womb to tumors, and some of us are closer to the tomb than others. And an unfortunate side effect of aging is that many of us will lose some of our strength and mobility. But that doesn't mean that exercise stops working. We just have to honor where each of our bodies are at. So for back pain, learning how to do some core strengthening and mobility exercises when we can't go all the way down to the ground or move heavy equipment around can be a challenge. So I'd like to show just a few basics that you can do standing and leaning up against a wall. In yoga, they use cat-cow, down dog, and cobra position a lot to help with lower back and hip flexibility. Well, we can replicate those poses against the wall. So standing at arm's length and maybe a half step or two back, the first thing we're going to do is a down dog type maneuver. So this will help with shoulder health and overhead reaching ability, as well as lower back pain. So pushing against the wall with strong feet, I'm going to push my butt back, and as much as possible, I'm keeping a straight spine. I really don't want to let my spine arch. I don't want to round my back, and as neither I want to arch my back. Just straight back, push my butt back until either my shoulders or my hips say that's enough. Then trying to smear my hands down the wall. That'll activate my lat muscles or my armpit muscles, and that pulls me back up. So see if we can get 10 to 15 repetitions of our wall dogs, if you will. A lot of back pain is also due to loss of extension, or when our hips are in front of our shoulders and feet. So similar thing, we're going to stand at about an arm's distance away from the wall, and then we're going to look back at the sky and try to pull our hips into the wall. I'm really squeezing my gluteus maximus muscles here. The more I squeeze my glutes, the more I protect my lower back. This is a theme that I'll explore in other videos and other exercises. But again, strong glutes, less pain in the lower back. So I'm going to pull my hips towards the wall and look back up at the sky, trying to squeeze all of these muscles along the way. Do this until your body says that's as far as I want to go, either because of pain, mobility, or strength. Fred here has atrophied a lot of his spinal stability muscles, and the one that we want to pay attention to because it's so often neglected is the quadratus lumborum. It's the muscle that attaches from our lower ribs to the top of our hip crest, and it controls our side-to-side motion and stability. So if we stand at about elbow length away from the wall, we can gently lean our hips into the wall, and then once we get as far as our spine is going to let us, we're going to tighten these muscles and push our hips away from the wall, getting a good squeeze at the top of my range of motion. Slowly let those hips sink back towards the wall until your body says that's far enough, and then squeeze those muscles again, pushing those hips far away from the wall. Other things that might help make this more comfortable, one thing that I like to do is have my inside leg about a half step in front of my outside leg, and that creates a little bit more balance, and it's a little less awkward on the hips. So this is a standing version of a side plank, which is one of my favorite exercises to help with back pain. And if we're not able to get all the way down to the ground to do a traditional side plank, then please lean up against the wall.